the challenge is, as has been made at any time, in any history, with any new technology, that the balancing of the protection of and the respect for human rights and freedoms, together with the advancement of medicine and science. History has determined that medicine and science, indeed technology, improve the human existence rather than hinder it. And therefore, just as in the past, a balance must be struck to enable that the benefits of discoveries such as those in the field of genetic research be advanced, not unabashedly, but rather fruitfully and with a lessening of restrictions. There is legislation at the federal and provincial levels in Canada that strictly manages the confidentiality and privacy of an individual's information, be it written, sound, computerized form, or otherwise. This legislation not only requires that the consent provided by persons who participate in research in the advancement of genetic studies or who want their genes mapped be free, be clear, and be enlightened, but also that the results of the science or mapping should be kept entirely private. The challenge for healthcare professionals and researchers becomes the ability to legally and ethically maintain the said confidentiality against an insatiable appetite and desire for genetic information. In other words, once the consent has been provided by the person concerned, who may or should have access to the information, after that, or further on, how they should disseminate that information becomes somewhat subject to the healthcare professional. If you look at the Quebec Act respecting health services and social services, it strictly protects the confidentiality of patient files at any of our institutions. In fact, one of its sections, section 19, states the record of the user is confidential. No person may have access to it except with the consent of the user or the person qualified to give consent on his behalf. Furthermore, McGill University Health Centre users, and indeed all Quebecers, are further protected by the Act respecting access to documents held by public bodies and the protection of public information, insomuch as it limits accessibility to personal information held by those public bodies by three mechanisms. The first of these mechanisms was described above, basically free, clear, and enlightened consent of the person concerned by the information. The other two, the authorization by the Commission d'accès à l'information, allows the public body to release information if there is a public cause that is required and that has been proven by a few very, very strict conditions. And finally, the authorization of the Director of Professional Services or the Chief Medical Officer of an organization does have the authority to examine the record of a user for study, teaching, and research purposes. Institutions such as the McGill University Health Centre are not, however, simply in the business of providing patient care. As an academic health centre, a larger mission that includes research, teaching, and technology evaluation must be fulfilled. And so in fulfillment of this mission, the McGill University Health Centre acquires invaluable information needed to advance medicine, information that can and should be placed, but with limited legal or administrative obstacles, into electronic health records. Such a position is consistent with the arguments advanced in the 2006 FRSQ Governance Framework Report, which again supported the fact that the legal framework is ill-suited to the reality and objective of data banks and biobanks, the use of which can be maximized if they are accessible for new research projects, which could be carried out at a time unknown when the data or biological material were banned, and which recommended that making laws that have the provision for personal information protection be adapted to the emerging trends in health research, so that such laws recognize the legal validity of data banks, of biobanks, and of the research exploring themes, rather than specific hypotheses. The Government of Quebec's Bill 51, an act to amend the act respecting the RAMQ, or the Health Insurance Act, and the act respecting health service and social services, enacted in December 2007. Bill 70, an act to amend the act respecting health service and social services. All of these were acts that our good friend, the Minister Philippe Couillard, put into place, has really, in fact, allowed Quebec to really sit at the frontier of health electronic records. Let me just introduce a couple of concepts from these acts. Bill 70 and Bill 83, which have not yet been enacted into law, basically will introduce the principle of implicit consent by all persons who receive such services in Quebec to the storage of that information by an agency or institution the minister authorized to set up. The opportunity to set up regional storage services, in many cases. All of these will now be provided by law. It also sets out the operating rules of which this data can actually be used. Once enforced, Bill 70 and Bill 83 will go a long way to demonstrating that the Government of Quebec is genuinely engaged and heeding the call to balance the advancement of science and medicine whilst maintaining confidentiality and privacy. For example, in a document that supports Bill 51 and 70, entitled Conditions Governing the Implementation of the Experimental Quebec Health Record Project by the Minister of Health and Social Services in the territory of Health and Social Services, it stipulates that the aim of the Quebec Health Record is first to give authorized health service providers access to relevant, to organized, integrated, and updated information to enable them to quickly assimilate information on the health of a person when they take charge of that person or dispense any kind of health service to the individual that continues and is complementary to the service dispensed by other healthcare providers. And secondly, to ensure that the effective communication at a subsequent time of the information contained in the Quebec Health Record to other healthcare providers for the sole purpose of dispensing health services. These are extremely important acts that will really put the opportunity for us to continue on the scientific high road will be balanced by the patient's need for privacy and confidentiality. Two major sections are important, but I've just described one that is so important within these acts, that no person may have access to any manner, in any manner, to information or to an extract or copy of that information for the purpose of entering into a contract that calls for an assessment of the person's state of health, such as a personal insurance contract, an employment contract, or a contract made during employment or at any time during that contract. In other words, the law is challenging and putting forth really strong arguments about where Quebec stands in relationship to privacy and to the scientific rigor of being able to use data. Our Quebec initiatives responds to both the 2006 policy conference, which was initially hosted by Canada Health Infoway, as well as the 2004 UNESCO International Declaration on Human Genetic Data. And I quote, "Healthcare is the world's most information-intensive industry.